The long-term care insurance industry has taken some real hits. Many insurers mispriced their products, misjudging how expensive nursing home and in-home care would get. The industry has responded with new underwriting standards, new prices, but some say the government now needs to step in to make it easier and more affordable for more aging baby boomers to sign up for coverage. Bertha Coombs has the second in NBR's series on how to navigate long-term care on an industry in transition.
Long-term care insurers paid out over $6.5 billion in benefits in 2012 to more than 250,000 customers, according to an industry study, with some ongoing claims now topping 7 figures.
The largest claim that's still open is from a woman. She's been on claim for 15 years. Her insurance policy has paid out $1.8 million to date, and it continues to pay. She only paid $881 for 3 years before her claim began.
It's an extreme case of unprofitable underwriting, but reflects the problems which have rocked the industry over the last several years, leading major plan providers like MetLife, Prudential, and Unum to stop selling individual policies.
There are a lot of reasons for these market exits, the most important of which is that companies have had a very difficult time hitting profit objectives,
resulting in a virtual perfect storm, with long-term care costs rising faster than expected, the rate of clients letting their policies lapse much lower than estimated, and investment expectations too aggressive.
But it's been conditions in the bond market that have posed the biggest problem for insurers. Record low interest rates over the last several years have made it virtually impossible to generate enough growth from their investment in bonds to meet the expected growth in future claims.
When interest rates start to rise again, and they will, this business will return to heightened profitability, or at least levels where it needs to be. So it is sustainable.
The Affordable Care Act had included plans for a voluntary national long-term care insurance market, but they were scrapped when underwriting proved too unwieldy. Now a congressional commission is drawing up new proposals on how to address what is expected to be a massive surge in demand for coverage from 76 million aging baby boomers.
Right now, we have 10,000 people that are retiring every day. We need more companies in the market selling to meet that need.
Mark Cohen, co-author of a Scan Foundation study on long-term care reform, says it will take a combination of public and private sector initiatives, with government reinsurance as a backstop for long-term care underwriters and getting more employers to help workers save for long-term care as they do for retirement through 401ks.
Taking advantage of the employer group market would be very important. You know, only less than 1% of employees in the United States are working in firms that offer private long-term care insurance.
Industry officials say with the Obama health plan launching next year, the commission's focus needs to be on private market solutions.
I don't see Americans ready to take on a new national program, a new taxpayer-paid program, not in the foreseeable future.
For Nightly Business Report, I'm Bertha Coombs.
Our series, How to Navigate Long-Term Care, wraps up tomorrow with a look at what to do when insurance isn't an option. And for more on the issue, log on to our website, nbr.com.